When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Justine McIntyre sitting in for Elias Makos today and for the rest of the week while Elias continues his voyages, his travels through the United States. Obviously a big week for the U.S. and we've been talking a lot about the U.S. election. When we wrap up the show, we're going to talk about that a little bit more. Right now, we're talking about a major spike to 311 calls this year. So bringing it back to Montreal now. 2024 has seen a major spike in calls about social issues, whether it's homelessness, mental health issues, issues related to visible drug use. The first 10 months of this year alone, there were a record number of 1,156 calls to 311 about these types of incidents. That's nearly 25 times more than the year before the pandemic, 2019. Here to speak with us about that is Robert Beaudry. He is Montreal City Councillor in the Saint-Jacques district of the Ville-Marie borough, and he's also a member of the executive committee responsible for urbanism, for the public consultation, Montreal Public Consultation Organism, and for homelessness. Welcome to our show, Robert Beaudry.
Thank you. It's a pleasure, Mrs. McIntyre.
First of all, calls to 311 are a pretty good indicator of what people are seeing and hearing and feeling on the ground. Yeah. So what kind of a message, how are you receiving that message?
I mean, it's not a surprise for us because we know that there's a huge increase of homeless situation, poverty in Montreal, especially in the downtown. So that's reflect in the number, in the statistic of the 311. And also, we had new services during the last month of social teams on the field to respond to the concern of the population, to try to help those who are in the street, people who have mental illness, to try to bring them through services. But it's really hard because there's a lack of social services, hospital, shelter with medical facilities. So we continue to work, try to solve problem, but as we see, as Montreal sees, there's a lot of people right now need help.
Which are the areas that are the most affected? When we talk about these 311 calls, what are the areas that they're coming from mostly?
Yeah, it's not a surprise. We talk about it in the media, the Chinatown, the village, near some facilities who deserve services in the Sud-West. It's places where the most vulnerable are, but also there's some places where criminality are as well, and it's for that reason that we had police services, because the criminality actually take advantage of the homeless population, and we talk a lot with the need of cohabitation with homelessness, but we ain't going to cohabitate with criminality, and it's for that reason that we need to have a response for the homeless population with the MS team, but as well we had many police officers or security in those areas.
Well, it's unfortunately there is a dependence because we can talk about homelessness, and homelessness is an issue, but yes, there's also an issue of drug usage, and there's a dependence of people that are using drugs on their drug suppliers. So wherever you see drug usage, you're likely to also see criminality and
Absolutely.
drug supply. So that's what's going on here. And yes, I hear you on the social services, but when we talk about drug consumption and we talk about criminality and people selling drugs on the street, why is that being allowed to happen? Why are we not seeing police intervention?
I mean, we had police intervention because, like I said, there's no cohabitation with criminality, and we want to be clear on that point. It's something that mutating during the years, the criminality, the selling of drugs, the drugs change a lot. There's more addiction, there's more methamphetamine in the street, more opioid as well. So we had police officers, and even in the sector of the village and the Chinatown, we had private security services to to take data about those organizations. But it's an organization. It really takes time to get them, because at the minute that you arrest someone, there's another person who take places. So we understand that if we want to work on criminality, we had to have more services, more police officers on the ground, and it's what we did right now. But as well, if we work with the government of Quebec on the decreasement of homelessness with adapted services, maybe we can as well bring population far from that person from the criminality organization. So it's on the both way that we need to work as a society, because the city of Montreal is on the front line, but that's an issue of society when we talk about dependency, when we talk about criminality.
Yeah. Well, we've started to hear a little bit of a change in discourse from the provincial government on this issue, because up until now, it's been about, this is people's free choice. People are making a choice. They're making a choice to consume drugs. Yeah. They're making a choice to find themselves in the street. And now there's been a bit of a shift. I'm hearing a shift in rhetoric where it's now that position, that approach is now being questioned. Yes. Because when you're talking about people that have addiction issues, serious addiction issues, is it really their choice to be on the street? Is it really their choice to be consuming those drugs?
No, it's a lack of option. It's not a choice.
Okay,
it's really a lack of option. If we can provide enough social services, if we can offer enough social housing, if we can offer enough facilities all in all districts, because actually there's mostly concentrate in downtown Montreal, maybe we can prevent those kind of issues. There's a lot of young people who are actually in the street. They compensate about 30% of all the 5,000 population of homeless population. Why? They came from the DPJ. Can we prevent those who came in the street in the first time by getting them a job, getting them an apartment, try to work with social and medical issue. So it's never a choice. It's a lack of option.
Mm-hmm. I would agree with you on that. And I want to bring it back now to Montrealers, because I just want to say, Montrealers, you've got to give them credit, because they're extremely empathic. Montrealers are caring people. They care about one another. They're patient. Montrealers are welcoming, and they want to help. And I don't like it when people are being accused of being NIMBYs. This is not NIMBYism. Montrealers, the people that are calling 311, they're doing it because they're feeling overwhelmed. We heard from a dad yesterday who was talking about walking his daughter to the CPE and having to explain things to her that no parent ever wants to explain, about open drug use and just things that their child sees on the way to CPE. What can you say to reassure Montrealers about some of these concerns?
I'm totally agree with you. I represent the borough of Saint-Jacques. I think it's the place where there's most the concentration of social services, and people are patient, and it's not acceptable to face criminality. It's not acceptable to face to someone who use drug in front of our children. But what I want to say to them is that the city of Montreal, the administration, working really hard with the government of Quebec, with the social organization, to give them the tools to social organization to accompany those persons, because it's not without social services that we're going to solve the problem. It's with enough financing, enough funding of those facilities, and all around the territories, really well integrated. We need to fund our social services as we found our service hospitalier. And right now it's not the case, and there's a crisis in Montreal, and we need to address that, and our administration is on front line and going to continue to do so, but we ain't going to let the criminality take our district. It's really important.
I think it's really important too. Thank you for speaking with us, Robert Beaudry.
Thanks a lot.
We've been speaking with City Councillor from the Saint-Jacques district of the Ville-Marie borough, Robert Beaudry.